is my dinner. But first of all, let's get changed. But I'm keeping the hat on because I'm cold and it's chilly in England right now. Hands are washed and ready. And this feeds into my heart, which is my Hickman line here. She's called Faith. And she's a double lumen. So one is for TPN, total parenteral nutrition, and one is for fluids and medications. I have gel all the time. Someone asked me, what's wrong with you? Well, there's a lot, so where do we start? I can't eat because I have something called gastroparesis, which is caused by EDS, Ehlers-Danlos syndrome. But mine progressed from gastroparesis to intestinal dysmotility and then onto intestinal failure. And I also have severe reverse peristalsis. So first of all, this is my sterile field. I'm going to open everything up sterilely and drop it into sterile field. Because this line here sits in my heart, and any germ that gets into it is straight into the heart, straight into the bloodstream, straight away bacteremia, which is extremely dangerous. Yes, gastroparesis literally means stomach paralysis. So when I'd eat, normally when you eat, your food moves through your stomach and your systems and goes through you. Within kind of 4 hours, it's normally through your stomach, and you can have tests to see how long it takes. With gastroparesis, it's slow, delayed emptying. Slow gastric delayed emptying. Mine, lost my bits, there they are. Mine was so bad that I had chips one night, and then still 24 hours later, I was vomiting, and you could see undigested chips in the sick bowl. I know TMI, but literally. And that was after a doctor said to me, no, you're making it up, you just don't want to eat, it's eating disorders in your head. And I was like, maybe it is, maybe I'm going mad. This is years, this is like 10 years ago. So I got fish and chips from the canteen, I was in hospital, and then I vomited for the next few hours and on to the next day. And you could see the undigested chips in the sick. And I kept the sick because I don't throw it away. Girlies who have gastroparesis will know this, because on a gastro ward is where your dignity goes to die, for one. And it's where you have to fight to be believed, unfortunately. If you don't and you haven't gone through that, then I'm really glad for you, but a lot of us have. And then I remember one of my specialist nurses walked in and said, Ruth, I believe you. And I just cried because someone believed me. So one of the symptoms, main symptoms, is that delayed emptying. So when you eat, it stays in your stomach longer, doesn't move through, and that can cause pain, nausea, vomiting, bloating, and so many other problems. And it can be just localised to the stomach, but then mine moved into my intestinal tract and into intestinal dysmotility. So moved into my intestines as well. So then over the years and years, it got worse and worse. And I did start off with NG feeding in the stomach. That was a fail. But I had to do it to show that it didn't work, basically. You have to go through all the options to show doctors, especially ones who don't believe you, that it doesn't work. So NG feeding in through the nose, down to the stomach, just vomited feed. So that obviously wasn't working. So to bypass the stomach and go into the small bowel. Did that through a PEG J, tube into your stomach and then the extension into your small bowel. But then it flipped and again flipped. And that was realised because I have such bad backwards peristalsis that was why it was happening. And it would curl. And I remember one doctor said, no, it must be the person who's putting it in. So she went down and did it herself and clipped it to the small bowel. And within less than 24 hours, I was back in the ward and it flipped and curled. And she said, wow, I myself did that, and wow. And then they realised how bad my peristalsis was. So then I had to have separate tubes to separate them. So separate jedge for feeding, and then a separate peg for draining, because me personally, I would vomit loads and loads, just bile, not eating anything, just literal bile. It was so bad. So my peg was put in for drainage only. And then a bonus of that later on is that I can drink fluids and drain it out and not vomit. But it was put in primarily because I have such severe, my body can't even push the bile through the system, which is just heartbreaking. And then I had many years of jedge feeding, which did work for quite a while. And then things progressed. This is over a course of 10 years, by the way. I'm going to clean my TPN, where I'm going to spike next. And there's non-touch technique, as well as obviously using my sterile field and sterile gloves at the end. But I'm never touching the important bits as well. And again, people are taught in different ways, so everyone has their way they're taught, and they've been taught by the nurses and specialties, they're tertiary hospitals, because you can't go home on TPN as on a local hospital, you have to be under a tertiary specialist hospital. And my giving set, which is going to spike into the bag. This is like my knives and forks, I guess, going into the what should we eat? Sausage and mash and beans and gravy. Oh, and broccoli on the side. Oh, love that meal. The weird fact, I used to love cold beans when I was younger. Anyone else like cold beans? Was it just me? Like straight out the tin. Yeah, cold beans on toast. Lovely. I find it weird hot beans. And then weird girly here. Weird from a young age. So yes, the jedge feeding worked for a while, but then things progressed. I have other problems with my health within my EDS. I have problems with my joints, unfortunately with my heart as well, and I have problems with my autoimmune disease, and then I have Addison's disease. And then I have problems with my immune system, getting constant infections, like simple like cold, cough, and turn into pneumonia quickly. I've had sepsis multiple times. I also had a head injury back in 2014. So yeah, there's lots going on, not just the gastroparesis and gastro problems, but talking about the gastro problems and how it led me to TPN. So I was on judge feeding, and then it got harder and harder to maintain. I kept being sick and vomiting, and I could only manage a really low rate. And I'm not talking about rates numbers, because I don't think it's good for that, because everyone's rate is important to them and what they can manage, and it's not about judging or comparing. I was getting a lower rate, very little calories in. I could only manage one type of feed, which is the elemental feed, which is really good. But in the end, I tried all feeds, and in the end, that one was the last resort. And even on that, I couldn't manage enough to sustain me. I was losing weight, I was getting malnourished. And then I had 18 months where I went into hospital to have fluids twice and then 3 times a week. And it was during COVID times. So I was going in, I couldn't have them at home because I was under a specialist hospital then, and my local hospital couldn't give them at home, but I couldn't manage without them. We tried without them, and I was in A&E within 2 days. So I came in 3 times a week, Monday, Wednesday, Friday. It's like being at school for 6 hours to have fluids and potassium 3 times a week, until I saw my consultant at the specialist hospital, and he then agreed for it to be done at home. Then I had just fluids at home alongside the judge feeding, hoping that the fluids would be enough IV to keep with the judge feeding going, not need TPN. And fast forward, in the end, basically, this is priming now, all the way through here. It's going to end up coming out down here. I ended up being admitted. I was BMI about 15, and I was very unwell. And basically, eventually, I got started on TPN, and eventually it was the home TPN, because the judge feeding wasn't enough. It was starting to affect my other organs, and we tried every single thing we could. And my consultant said, it's okay. Not it's okay. It said, it's okay, because we said when we met, which was 3-4 years before that, we said we try everything, and we have done every single thing on the path. And that's what's really important, not to jump the steps. I think it's important personally, because if you jump a step, you don't know what that could have helped. If you go through every single step and you show the doctor that you've done every step, then you know that when you get to that stage, you've tried everything in your power before getting to the home TPN. You know, and maybe I can, maybe there'll be a miracle, maybe there'll be a new medicine, maybe there'll be a new treatment. I'm not giving up hope, but for now, this is where I'm at. So I feed into my heart here. That is all primed and ready. And it means it bypasses the whole digestive system. So you can either eat orally, enterally through your stomach or small bowel, or parentally, which is through a line like this, Hickman line, in straight to your heart and your bloodstream. It's not easy though, because every night you have to do this. And I do fluids on top, because I've my problems with my kidneys and bladder. I have fluids on top. That's why I have a double lumen, because one lumen is dedicated to TPN. Some hospitals, some patients do actually use one lumen for both things, but my hospital don't. We like to just have one dedicated lumen for TPN, and then the other one for meds and fluids, because there's less infection risk. There's a huge infection risk with TPN. And central lines, obviously. Hear that squeak? That's what you want to hear. Get another one and clean up the line as well. If you have any questions, feel free to ask, and I'll try to answer. I love raising awareness when I can. The line, and drop down. I'm just going to finish another clean along and then on top. And when I first started home TPN, it's very overwhelming. And I was in my specialist hospital for about 8 weeks, being taught, learning about it all. And then I had nurses come out and do it for me for the first kind of 6 months. And then I learnt myself, and you have to pass tests basically on disconnecting and connecting. Like putting on sterile gloves. It looks easy. It's like brush my teeth now, it's normal, but you can't touch. You can touch the inside, but you can't touch the outside because that's sterile. But now with this hand, it's sterile, so I can touch the outside of the glove here, and then put it like that inside. It's hard to explain when you're doing it, but basically it's not easy as it looks. On. Touch the middle, that's sterile. So first of all, we're going to remove the blood, because there's Churlock in the line. Make sure it's unclamped. Yep. Churlock sits mine is 3 to 4 mils, and it sits just in the line to prevent infection and to help with trying to stop bugs getting in. And it's really useful and really good, but you only get it because it's expensive if you've had more than a certain amount of infections or sepsis a year. Well, that's what my hospital do. That's going to go in the sharks box. Then we're going to flush. It is overwhelming at first. It becomes normal this, but it is weird that this is my Sunday roast dinner. And I do miss food, yes, anyone who asks. I do miss food all the time. And again, another disclaimer that if you have gastroparesis, it doesn't mean you're going to end up like this on TPN or with intestinal failure. Mine progressed to that level, but it was over the course of 10 years. And I'm 31 now, and it started getting really bad. I've also had symptoms, but it got really bad when I was like 19, 20. So I don't want people to panic and seriously think, oh my gosh, that's going to be me. It's really important. Everyone's on their own individual journey. And also, you see this, but there's so much I don't show as well, so much you don't see. and that's really important to remember. We only see a snippet of somebody's life. But yeah, this is my little kind of talk about gastro problems, intestinal failure, EDS, gastroparesis, being on TPN, what it means. If you've got any questions, let me know and I'll try to answer. And do you like seeing the setups? Is there anything you'd like to see? Let me know. Right, it's all primed and ready. Then we're going to connect, TPN line, yes. And we are connected for the next 18 hours at the minute. And I've got a rucksack it can go in as well as the pole. And I'm in hospital obviously currently, but hopefully I'll be home very soon. Right, so let's start this. Go! And then we're going to put the red cover bag on because it needs to be protected from the light as well. But I'm going to go now because I'm shattered. But hope you enjoyed this. And let me know if you have any questions or, yeah. I love you all. Mwah. Shush.